Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Raya Kaplan. She's a gastroenterologist here at East Cooper Medical. Thank you so much for having us today. It's good to see you.
Good to see you. Thanks for coming.
All right, so I love the topics we talk about when we get together. Today we're talking about diarrhea.
Yes.
Everyone. So first off, I'd find it hard to believe that people don't know what it actually is, but from a clinical standpoint, tell us, what is diarrhea?
Yes. So today, yes, we're talking about the fun topic of diarrhea, which we all get, so nothing to be embarrassed about. But truly, diarrhea is watery or loose stools. They can often be more frequent. Some folks come in saying they're having more frequent form stools. That's not technically diarrhea. Diarrhea is loose pieces or watery. Sometimes it can be associated with abdominal cramping, abdominal pain, some urgency to go to the bathroom, bloating, and other symptoms.
So what causes that typically?
So there's lots of different causes for diarrhea. Just to name a few, most commonly like infections, like a viral gastroenteritis, something like Norwalk virus, CMV, which is less common.
Like IBS, is that one?
No, IBS is actually a different category.
Oh, okay.
So infections are more viral or bacterial, things like foods that have bacteria in them or contaminated drinking water can cause infections like Salmonella, E. coli. IBS falls into a different category, which is more functional bowel disorders, not caused by infection. Other possible things that can cause diarrhea, certain medications, some diabetes medications can cause it, like metformin. Some GI medications, like PPIs that people are on for reflux, can cause a bit of diarrhea. Other things like lactose intolerance, fructose intolerance.
So you got a lot of things to consider.
Yes,
like,
there's a lot of different
things. How do you diagnose
things.
that? How do you know? I mean, obviously, you can have like a stomach bug or something like that, but how do you know the root cause of it?
Right. So, everyone gets diarrhea here and there. Nothing to be alarmed about. Eat something that didn't quite agree with you or get a little upset stomach for a day or two, not a big deal. If you have persistent diarrhea that doesn't go away after several days, that's something to get looked at by either your primary care doctor or come see a GI doctor. The initial workup typically is stool studies to look for those infections. If infections...
Real quick though, like how does that work?
So, so that involves actually collecting a sample of stool.
You do it from home?
From home, correct.
Okay. It's like,
so you get
a lot of pressure.
So you get a little collection jar and you collect your stool at home and drop it off at the lab. And that gets run for different cultures. We'll check for Salmonella, Campylobacter, Shigella, E. coli, all the common things. C. diff, which is also something you can get that causes diarrhea. So first step is typically stool studies. If that's negative, then I'll go over a medication list, make sure there's nothing obvious, like a new medication that might have triggered the diarrhea, get a dietary history, see if there's any correlation with dairy products. If someone drinks a lot of foods or drinks liquids with a lot of sweeteners in them, sometimes that can cause diarrhea. So that's kind of the initial workup. If all that is unrevealing, then often the next step is a colonoscopy to look to see if there's issues like ulcerative colitis, Crohn's, microscopic colitis. All those are things that cause diarrhea but require colonoscopy for diagnosis.
I find that I'm learning so much from y'all about the GI system and all. It's crazy how many things that y'all are learning. It feels like it's really expanded over the years.
Yeah, some of it has for sure. There's definitely more that we know about inflammatory bowel disease, which is IBD, versus IBS, which is irritable bowel syndrome. And with IBS, there's IBS with diarrhea and IBS with constipation. In this setting, obviously, the IBS with diarrhea is what I'm talking about. But yes, there's a lot more that we know now about IBD, IBS, infections, checking all that's been around for a long time.
And with like treatments and stuff though, with different medications, and that's kind of, how do you approach that to decide which is the best?
Right, so it really depends on the cause for the diarrhea. Initially, while we're working it up, definitely just hydration, kind of a bland diet or the brat diet that, most folks kind of know about. Bananas, rice, applesauce, toast is the brat diet, so sort of a bland diet to help control diarrhea. Once we're waiting on stool studies, if they come back negative, we can sometimes start an anti-diarrhea medicine just over the counter. Importantly, we don't often want to start a diarrhea medicine before we rule out certain infections, because that can actually make it worse if you take a diarrhea medicine with certain bowel infections. And then in terms of other treatments, it depends on the diagnosis. So if you end up having something that we find on colonoscopy, like ulcerative colitis, Crohn's, there's a whole set of medications for those. If you have something called microscopic or collagenous colitis, which can cause diarrhea and is different from ulcerative colitis and Crohn's, there's different medications for that. Ultimately, if the whole workup is negative, and it's most likely that you have something like just IBS with diarrhea, then that's typically treated by avoiding food triggers, diarrhea medicine, minimizing stress, but there is
I was about to say, can stress just be it?
Stress could be it, but it's important to rule out lots of other
things.
things before you assume it's just stress.
Gotcha. All right,
Yeah.
before we head out, how do we come see you? Like, how does this work?
So super easy. You can either call the office.
Do you need a referral, or is it?
A referral is great. If you don't have one, that's fine too. So call the office number, 843-936-5970. You can head to the website, www.eastcoopergi.com. And I do have several locations. So I'm in Mount Pleasant on Whipple Road. I have an office location on Daniel Island, and I have a new location in Somerville out by Nexton. And I'm doing procedures, endoscopies, colonoscopies in Mount Pleasant as well as in Somerville.
All right, you're a busy woman.
Yes.
Thanks for being with us today.
Thank you so much.
For more information, head online to eastcoopermedctr.com.